Corona. Who are you to stand in our way? Who are you to stand in the path of the righteousness?
So how did you get to this camp?
I was actually standing by the robot, and then the traffic officers that forced me to get in and come to the side.
And do you want to leave, or do you
Currently,
prefer?
no, I don't want to leave because I feel that, thank you for coronavirus, I can actually start to change my life. So thank God for this, because otherwise I would have still stayed on the streets and done my old things.
This is Julian. He is a substance user and is also homeless. He is currently staying at the Lyttelton Sport Park in Centurion, one of the shelters in Gauteng. These grounds have become home to nearly 300 homeless people since the lockdown began. But the numbers keep fluctuating as more continue to be transferred to this place. Here, high security is in place with barbed wire fences surrounding the grounds and the police constantly keeping watch. But there have been a number of cases of people escaping or trying to escape, and yet many of them have also returned.
Those who left are those who are naughty, who smoke drugs, who don't want to be here with us. But when it's hard outside there, they don't get food, they see that life is really hard, they come back here. And they are out there, they are crapping dustbins, then they want to come back here. Then us, not me us as a whole here, we don't allow them to go outside and come back here to us. We are also fighting this thing. We don't know if they can get a place where they can keep those they arrest outside. Here we want to be by ourselves. That would be so nice.
For the most part, many of the homeless here say they prefer to stay at the shelter.
Miss Lady, being outside is really, really bad because everyone is on lockdown, you know what I mean? There's no one walking on the streets, no one is allowed to work. Some people are not even working, so it's really hard for us to hustle on the streets, you know what I mean? I think this is the better place to be right now.
No, I'd rather be here because of here we are safe of that coronavirus. No? And then outside is not safe because of we are meeting one another. People whom you won't recognize when you have that coronavirus.
Here at the Lyttelton Sport Park, the homeless are provided with mattresses and blankets, hygiene products and clothes which have all been donated. Social workers are present to help those who want to reconnect with their families and to help them pave their way to a better future. Medical facilities, specifically through means of COSAP, a non-governmental organization, are there to help substance users with their addictions and other acute medical conditions. The homeless have been screened for COVID-19, and so far, nobody at the facility is thought to be infected with the coronavirus. One of the doctors there says they are noticing a change in some of the residents.
I have met quite a few patients that I've had, a heart-to-heart conversation with. There's one who's just recently been married. He's also on substances. His wife is also using substances as well. So we're just having a conversation as to what will the plan be, from coming out of this shelter. Do you think that you're going to do things differently, especially now that you've got a responsibility? You're going to have a family soon. I don't know how or when you will probably plan to start doing that, but you have to start thinking around those lines. And you could see that, for the first time, he's actually thinking of the reality of the situation and how he needs to make changes in his life. Should we not have, come here, we do not know what chaos would be erupting because, patients are having, withdrawal symptoms. And although there are Metro Police to try and control them from, dissipating outside and walking around and exposing themselves to the risk of COVID-19, if we weren't here, we do not know what that implication would be outside. So if other shelters could also be afforded the opportunity to have these kinds of services, I think it would really make a huge difference. And most of the patients who are escaping from shelters are patients who are trying to get either the medication or the substance itself. And so if we try get that in order, then we tackle a lot of issues and we try and minimize the risk of COVID-19. So this service is quite important, I feel.
One of the homeless living there Oyama has also volunteered to assist the doctors, even if it is only with washing the cups. He became homeless after feeling like he was a burden on his sister. He no longer has parents.
I'm helping my friends. It's too hard. And so I also have I don't know what to say. It's like I'm feeling that pain. It's also a pain to see my friends like this, because I know that pain they are taking. I've been there before. If I had a choice, I could not leave this place. I'm loving it here. You see, everything here is good. I'm having extra mothers in this place. You see, I'm having that love that I didn't get the first time.
But all is not perfect at the shelter, as there are still some issues.
It's going okay. It's just here and there that we're still fighting about food, especially the quantity of food, because with 90% of our camp we are drug-related people. So we are more hungrier than before. So the food they give us is a little bit too small these days. It's like you get like a small piece of pap and then a small piece of wort about this big. So it's not enough for us to eat. So then we fight about that. It is positive. It is more positive than the negative, although that the negative influence quite a lot of the people.
I stand before you today as we have received some few errors in the region of catering. The catering service has been degrading us starting from the beginning. They have been not bringing food in the right portion, the right standard. Today they give my comrades something that even me, I cannot eat as a snack.
Coronavirus, like I like to learn more about the coronavirus, but definitely there's no TV. So there's no radio, there's no TV. So we are just asking for the TV or radio also us to learn what's going on outside.
They have cried about being bored and not being informed. We have brought it into face and we brought it into many meetings, but nothing has happened. Any information they give is not in effect to us because we have been fed by the second source. We have to hear from the president himself announcing that he's announcing a shutdown and he's extending the dates. We don't want to get it from somebody else from the streets. Why are we neglected from the high societies or in the middle of the societies? Why are we not regarded as humans?
But on a problem-free day, the homeless can be seen adapting to their new normal and forming a community. Some of them have started entertaining through singing and performance, while others play soccer and card games. Some are also using their practical skills to help each other, such as Mpo, who is one of the barbers at the shelter.
When brothers don't have money to go and cut, there's no barber shops here. So I usually cut them. Others, they come here and then they just at least give me what they have. Even if you don't have, I'm able to help you without having anything, any money or anything to give.
Many of them say if it wasn't for the coronavirus, they would not be getting the help from governments as they are now.
They mustn't help us just because it's a virus. You see, they must also help us when there's no virus. Because the coronavirus is dead, please, can you please stay here just for 1 month so that everything will be out and our mind will be refreshed. We're asking that. Because without coronavirus, we are nothing. But when the coronavirus is out, please do not chase us away. Let us stay for 1 month.
For more, go to ewn.co.za.